Hi, I'm Dr. Paul Jared Frank, Director of the Fifth Avenue Dermatology Surgery and Laser Center. Today I wanted to talk about skin tightening and some of the various options out there for the face and body. One of the older technologies that came out about 10 years ago was the Thermage device. And the goal of this was to use heat by radio frequency to penetrate deep in the skin to cause initial contraction of collagen and subsequent regeneration of collagen that would cause tightening of the skin over a prolonged period of time, and that would be long-lasting. The technology has come quite a long way since then. There are competitive technologies as well. We have the most current device for the face called the Ulthera. At the Fifth Avenue Dermatology Surgery and Laser Center, we use both devices. They have different levels of efficacy, and we use them on different areas of the body. One of the most important things when considering skin tightening, first and foremost, is choosing the right candidate. Like an instrument, it can be played very differently, and not everyone is appropriate. The ideal candidate usually is in the 30s, 40s, and early 50s. I can treat older patients, but anyone with really significant laxity still requires surgical intervention. You need a certain amount of elasticity in the skin to tighten the areas of the skin, so it's best to pick the right candidate before you treat someone. Now, there are various ways to produce heat to deliver it into the skin. The original technology, the Thermage, and other copycat technologies such as Titan use radio frequency. Radio frequency allows us to penetrate relatively deeply in the skin to cause this clinical effect. There are other devices out there that use a combination of radio frequency and infrared light. To do significant tightening, there is a little bit of a no pain, no gain scenario, so you do have to use high energies. There are some technologies that instead of doing it in one treatment, attempt treatment over a course of therapies, usually 3, 4, or 5 times. In my clinical opinion, I've always found that the one-time treatments that are stronger are the most appropriate. In my practice, I perform everything, and my associates, we don't have assistants do this, so we cannot give appropriate sedation along the way. Over the years, the technology Thermage has developed. We're on, I believe, the 3rd or 4th generation now. We use it for face and body. I use it very commonly after liposuction, in lieu of liposuction, people who don't need surgical tummy tucks but want some skin tightening. We also use it for cellulite. We use it on thin people with mild to moderate cellulite. Again, this is another area where choosing the right candidate is of utmost importance. People who are very heavy and have significant dimpling of the skin really aren't the best candidates for this. The most exciting advance that we see recently is in some of the ultrasound therapy. Ulthera is the latest and greatest in this technology. It does have several advantages over the Thermage. First and foremost, it's much more powerful in terms of energy, and it goes significantly deeper. The Ulthera itself actually goes down to muscles, so we can get some of the tightening that we would normally do during surgical intervention, where they use a scalpel to tighten the muscles of the face. For now, it's only FDA approved for the face. We have not yet used it off body. That may change over time. Like the Thermage, this technology will progress. The candidates for the Ulthera, which is situated right over here to my right, still is a similar age range. We use it in the 30s to 40s, 50s. I can use it on a slightly larger range of patients with greater skin laxity because of its strength. It also hurts a bit more, and the technology is a bit more expensive. The pain issue is not really a factor, as I have various means of keeping patients comfortable, from oral sedation to injectable sedation, and even for the most nervous of patients, patients can be put to sleep. But it's an effective treatment that has very, very minimal downtime. Traditionally, the downtime for any skin tightening procedure is really just no downtime to just a day or 2 of mild puffiness. One thing that we do notice with the Ulthera technique is people do have mild swelling the next day, usually not preventing them from going to work. Bruising can occur, although it's rare, and also there is a sensation in the face that something was done, a mild soreness that only the patient can perceive. And again, this is due to the increased strength and efficacy of the treatment. So for now, which is 2011, the 2 technologies that I use for skin tightening are Ulthera for the face, that is my standard of care now for the face, and Thermage for the body. And you can see these 2 instruments right here. The Thermage here, we are now using what's called the Thermage CPT, that is the latest and greatest. And it has a much larger spot size. The technology is less painful than it used to be, and it's really just pulsing across the face of the body. When we do body parts, it is many more pulses and a much larger spot size. The Ulthera pulses in a different way. There are different sized cartridges that we use here, and we put it across the skin with an ultrasound gel as well. Again, one of the major advantages of Ulthera, which you do not see in the other technologies other than in strength, is that we could actually visualize, like one looks at a baby during an ultrasonic test. We could visualize where and how deep we are going in the skin, allowing us to penetrate all the way down to the muscle, which is about twice the depth of the thermage. And I think this is a very exciting technology we're going to see more and more of. Hopefully we'll be able to do this on the body. So again, there are a lot of technologies out there for skin tightening. Ultimately, it's not always the device, but how the device is treated. It's essential that a physician, a licensed physician, hopefully board certified in a cosmetic specialty, performs this procedure. It's important you pick the right candidate with mild to moderate laxity only, providing an appropriate expectation, and also pain control, because if the patients aren't kept comfortable, obviously you're not going to get an appropriate treatment. So with all these things combined, we now have a very good spectrum over 10 years of development in having mild to moderate skin tightening with these non-invasive devices. Thank you, and I look forward to seeing you on consultation.